Welcome back, and in case you're just joining us, the National Coordinator, National Center for Disease Control, Professor Nasidi Abdusalam, is our guest on Question Time. Talking about resources now, how much are you expecting in this post-Ebola intervention plan? With
the the post-Ebola containment plan, I think was costed to be about 45 or 50 something million US dollars, and we have actually categorize them into various distances and have started, seeing how we're going to raise the fund not only from the government. But this was written during the cold period. That is the period where the virus, Ebola virus disease was going down in these countries, and then Nigeria has succeeded in wiping out the Ebola virus. But with these latest developments and the fact that some of the new cases in Liberia, Guinea, and Sierra Leone are still coming of unknown sources of infection, it makes it a little bit more deadly that we need to widen, our scope on how to really, be ahead of this virus and not allow it to come into our country. Would you be scrapping the post-Ebola response plan? We are not. We are activating it. We are activating it, and it has started already. The Permanent Secretary has approved the program, and he has directed that we should start immediately. What happens to the initial 1.9 billion naira that was set aside? There have been lots of accusations against the Health Ministry of mismanagement of funds. How would you react to this? It's unfortunate. That is the most, how will I say, unwise allegation or statement to make, because Nigeria must commend those who managed the Ebola response, and from those who made the money available as the former president, and the then Minister of Health, Professor Chuku, and the management of the ministry. When the 1.9 billion was released, the wisest thing the ministry did was to establish a committee. You understand what I'm saying? That is a committee co-chaired by the Permanent Secretary and the Director of Planning in the ministry. And that committee was made of experts and management gurus. And, a very comprehensive response activity plan was developed. And that money was spent according to that plan. If there are some changes, they will be minor. So not one individual had access to that money, as some allegations were made. Let me also add that the allegations were made out of the blues with no real concrete documentation or reason to make it. And luckily for us, the guy who made the allegation was, a repentant or unrepentant, how will I say, confident trickster, a con artist that we couldn't believe was existing among us in the ministry, who came into the ministry with stolen MD certificate, of his friend, and worked here as a doctor for almost 10 years before he was detected. And I think it is in the process of being detected that he decided to, turn everything upside down. But the police, everybody, they are all investigating. I can assure you, there won't be any one individual found to have cornered the Ebola money. Now, regarding the alleged fake doctor that raised or blew the whistle about the mismanagement of funds of the Ebola intervention funds, is that an indication that Nigeria's health sector could be that porous? Very, very possible. That I can't say no. That's very, very possible. And that's what we are thinking of. How do you fix it? And please, you have to remember that these type of things can happen not only in Nigeria, but in many other countries. Only this is very frequent. But we couldn't believe that such could happen even within the Ministry of Health. Within the Ministry of Health itself. This is somebody who had no certificate that got appointed by this civil service and then came into the ministry to work. And unfortunate incident or aspect of this is that this person became even an extortionist, extorting money from people and so on and so forth. So, but that's not the most important aspect. The most important aspect that the Federal Civil Service Commission that employed him finally detected him and directed that he should be terminated, and made a presentation to the police. So the allegation of mismanaging the Ebola money, I can assure you, will be proven to be false.
We've also had reports of other diseases like the dengue and the Lassa fever. What's Nigeria's status regarding these diseases?
Well, Nigeria's status is to increase our capacity and ability to detect them, treat them, manage them, but most of all to prevent them from occurring. And the best way to do it is to get organized, establish what we call a National Public Health Institute. And that's what Nigeria has done. We established the Nigeria Center for Disease Control, which I'm now in the process of establishing. And that center is one that responded to the Ebola outbreak, and that we use that to show that we really need such a center.
Could you tell us the way forward to the emergency response and healthcare delivery in entirety in Nigeria, looking at our health reforms and the efforts made so far? What's the way forward? Nigerian
government in the last few years have really improved in what we say moving the health agenda forward. We have number one is what we call the Health Act, and that is a very major tool or aspect of our national development strategy. The Health Act has spelled out exactly what we need to do to improve the health of Nigerians. Part of it is prevention, and part of it is curative. The preventive aspect of it is to do exactly what we are doing now, establish institutions that can put in place mechanisms to prevent Nigerians from becoming sick. So the main objective of that is to keep Nigerians healthy. It's what do I do to make sure that you don't catch a disease, you don't catch malaria. I'll say keep your environment neat, use the integrated net, make sure that you keep away from mosquitoes or whatever. And if you have fever or have this, don't waste time, don't treat yourself. Go to the hospital, let them make sure that you don't have malaria or even worse disease, and you get, managed.
Let me take you back to the Ebola issue. Now, how many isolation treatment units do we have in Nigeria?
If we are to go by the number established by the states, we should have nothing less than 30, maybe 5.
Let's also look at the plight of the IDPs. People say this as a health risk for the nation. How is Nigeria responding to the challenge of this in terms of disease control in West Africa?
When you have IDPs, what do you have? You have people moving from their normal habitats, you understand me, into a strange habitat. Maybe either in the bush or in completely strange areas. And those areas could have sources for infection, for diseases. So what do you do? If you bring people that are coming from different places, come together as IDPs, some of them might bring diseases, and they are clustering within one area. So you have to quickly start, reviewing these people to know which disease they could come with, and start positioning drugs that you could use to manage those diseases. You have to immediately start advising them on what to do to avoid cholera, diarrhea, and any gastrointestinal infection, and and so on and so forth. Environmental hygiene, all this is so important. You have to start vaccinating. When the children come in, even the polio issues and so on and so forth, I must say that the Nigerian immunization team, the public health, have done so well, especially the primary health care agency, immunization, they have done so well that they are moving not just with the IDPs and immunizing, but even going within the areas of battle and so on and so forth, where there are exchanges of bullets, and immunizing what they call hit and run. They quickly reach the children, immunize them and run away, and all this, risking their lives. I think we're doing very well, but I must also commend NEMA, because NEMA, working with the MPCDA and then now with the NCDC, we are doing everything possible to do the following: prevent contamination of diseases, treat, isolate, identify, isolate, and treat if we find any, and then also mitigate the impact of any of these diseases.
Professor Abdusalam Nasidi, thank you very much for joining us in this episode of Question Time.
It's my pleasure. Thank you very much.
And that's as much as we can take in this episode of Question Time. You may also send us your comments on our various social media platforms showing on your screen. Join us next week on another exciting episode of the show on Channels Television. Many thanks for watching. I'm Benga Ashiru saying goodbye.